What is it you were saying? What is it you were saying, Dr. Osterberg, about having two types of muscles? What is it you were saying there?
With typical back injuries, there are two types of muscles in our spine. We have one group of muscles that moves our body. Those muscles are large muscles that cross multiple joints, and when they contract, when our body makes them tighten up, it moves the joints and creates motion in our spine. We also have muscles that only go from one bone to the bone right next to it. And when those tighten up, they don't create movement. All they create is stiffness. They create stability. When those muscles aren't contracted, our spine is just a loose chain of separate bones. But when those stabilizing muscles tighten up, the spine becomes like a big rod. It becomes a fulcrum that our big muscles can move. And most back injuries happen when those stabilizing muscles are fatigued, or they're tired, or they're weakened, and they may become weak and not be able to contract, or they might just be delayed and be slow. And it takes something as simple as shifting your shoulders, moving your upper body as you shift to get out of a chair, or to get out of the car, or to bend over and pick up a cup of coffee. And just that little shift, all of the joints are stabilized, but there might be one or two that isn't. And that joint stretches because the muscles were too slow to protect it. And then we get a little tearing in some soft tissue. We get some fibers being torn in a ligament or in a disc. That sets off an inflammatory response. We get inflammation. That irritates the nerves. Then we get muscle spasm. And now that patient's going to have an episode of acute back pain for anywhere from 3 to 10 days, where they're going to end up in our office. And it's all because of a little muscle that was delayed in firing in the spine. So our goal is to get them through that injury. The healing process has to happen. The swelling has to go down. The muscle spasm has to be relieved. They need to restore normal motion, but none of that is going to prevent that problem from coming back. Only exercise that helps train those little stabilizing muscles to make them fast and strong is going to prevent the same injury the next time they get tired. The next time they're out weeding the garden and they fatigue the muscles, and then they go to move and bend over, they may not have that same injury if those muscles are stronger and they're faster. They'll be much better protected. That's a lot of what we do with back injury prevention, and it works very much the same way in the neck as well.
Wow. How long does it take, more or less, to get a out of shape person, a person where you can suspect that he has some of those muscles not firing? How long does it take him to get in, relatively functional shape back? A week, a month, a year?
I've explained to you in the past that we do some testing with our patients. We run them through a series of 25 tests. It's called a qualitative functional capacity evaluation. And what we do is we have normal data. We know what we know what the results should be for the average grown man who doesn't have any back injuries. We should know what the results should be for the senior citizen woman who doesn't have any neck problems. So when we're having a patient do a test, we get to compare it to what is normal. And that's really nice, because we may run through the test with you and we may find out that 17 of those tests are fine, but we've got a couple of them that are really bad. And I may show you that, your strength in your lower back is only 13% of normal. Well, immediately we'll start you on a home exercise program, and we repeat that test every 2 or 3 weeks. And usually, even within a period of 2 to 3 weeks, we can see phenomenal changes. We can see 100% improvement. Now, you may go from 13% of normal to 26% of normal, and you're still not back to where you need to be. But we can measure and motivate that patient by showing them, you've made a lot of progress. Keep up the good work. You're on the right track. So that's what we do. When we're done treating the patient in the office, we've achieved relief from the injury and the pain. We'll get them exercising, and we'll monitor them until they're back to normal, or they're as good as they're going to get, and then we discharge them from our care and hope that they never need us in the future. But if they do, we're there for them.
Well, here we have it. Dr. Osterberg, an evidence-based chiropractor, based the treatment on evidence, based the prevention practices on evidence. I guess that's wonderful. Thanks a lot, Dr. Osterberg.